My name is Morgan Vogel, and I'm here to talk to you about brucellosis. So, what is the purpose of food animal production? Money. Without our animals, there would be no money. Are you or someone else you know a livestock owner? It's important to know about these diseases, what causes them, so that we know how to prevent and treat them if our animals become sick. I am an LVT student studying food animal, and I find this disease interesting. So, what is brucellosis? Brucellosis is a zoonotic disease that affects cattle, small ruminants, and even humans. If left untreated, it can become a chronic disease that causes abortion, infertility, and even the need to sterilize an entire herd, which could cost a livestock owner thousands, if not millions, of dollars. So, brucellosis is actually caused by the bacterium Brucella, but based on the species of animal, there's a different name for all of them. Brucellosis abortus is bovine brucellosis. How is it transmitted? It's transmitted through contact of the mucous membranes or through broken skin. Mucous membranes is thought to be the main route. It comes in contact with tissues, blood, urine. If a mother is infected, her calf will also be infected. Things like vaginal tissue, the placenta, or even fomites, such as feed and water. The bacteria can be on those fomites up to 114 days, as well as dairy products of infected animals. That's the organisms accumulate into the mammary glands, passing it through the milk. Therefore, it's also passed on to humans. So why does it matter? Brucellosis is a zoonotic disease, which means humans can become infected. Humans are exposed by coming in contact with the infected animals. Most human cases are due to ingestion of the contaminated dairy products. If left untreated, it can cause abortion, reduction of milk production, and infertility, which causes major economic losses for livestock owners. The clinical signs of brucellosis: cattle. The cows will abort their first calf after becoming infected. They will also remain chronically infected afterwards. They can become infected for years or indefinitely, and the infected must be separated from the herd. Humans. We can develop headache, fever, sweating, chills, weakness, weight loss. Treatment and prevention. Cattle, none. There is no treatment for cattle with brucellosis. Antibiotics may decrease the severity of the symptoms, but is often discouraged because of cost. Humans, clinical cases are treated with antibiotics. So how do we prevent brucellosis? Human exposure can be greatly reduced by controlling the disease in livestock animals. There are 2 vaccines approved for humans as well as cattle. RB51 is safer than strain 19. Those also can be used in cattle. We can pasteurize our milk products, which destroys the bacteria in the milk. Proper hygiene is super huge. It decreases human exposure. Things when we're dealing with meat, blood, organs, or carcasses from infected animals should all be handled carefully. Cattle. We separate the infected from the herd. If a livestock owner is unwilling to euthanize their animal, we castrate the males and do not breed the females. Clean and disinfect any contaminated area, such as where a mother gave birth to a calf or where birth products of the mother or calf could be. We vaccinate. Again, strain 19 or RB51 are used and are safe in cattle. Strain 19 is usually given between 3 and 5 months of age, whereas RB51 is used in older calves. Adult cattle may be vaccinated, but current vaccines contain live organisms which can cause abortions in pregnant animals. Um, so, to conclude, just a brief summary. Brucellosis is a zoonotic disease. If left untreated, can become chronic, causing major problems for animals, which can be very costly to livestock owners. It's important to understand the diseases, how to prevent them, how to treat them, so we can prevent future cases from occurring. Brucellosis is highly contagious. If one cow is infected and left untreated, an entire herd could become infected, costing hundreds of thousands of dollars for a livestock owner.